So a very warm welcome all of you guys. So in this particular session, we are going to talk about the occupational health diseases, right? So whatever diseases we are actually, having related to the occupation, right? So, everything is having their own side effects, right? For example, the drugs, they are having own side effects. The jobs are also having their own advantages, and at the same time they are having the side effects too, right? Nothing is ideal in this world. So if you talk about the occupation, right, our own occupation, that is the providing the healthcare to the community, that is also having some kind of side effects. What kind of side effects we might be having? We might be having some hazards related to the violence. We might be having some hazards related to the injuries. It might be the needle stick injuries. There might be the various kind of diseases we might get. For example, when we were working in the COVID scenarios, right? So what was the risk over there? We also might be, getting the COVID, but that is a part of the job. So that is kind of a, hazard, but that's the beauty of it at the same time. So these kind of diseases we are going to talk about in this particular section, right? So every kind of occupation is having some kind of, in a long manner, in a long term, is having some kind of disease, or it might lead to some kind of disease. For example, some doctors, they might be developing the tuberculosis, right, after 15, 20, 25 years of practice. Why is it so? Because when they are talking to the patients, right, they might be, coughing on their table, on their faces and all of these things. Then, there might be the starting of the latent TB, and then it can, convert into the Gons focus and, Asthma focus and other kind of things, right? So whenever the immunodeficiency happens, or whenever the immunocompromised state comes, right, and the TB might be getting reactivated. So these kind of cases might be there. But that is the thing. That is kind of you can say that, hazard of this particular occupation. So here, particularly in this section, occupation related diseases, we are going to talk about, right? So very first one which I'm going to take over here, that is very, very common, that is a pneumoconiosis. And pneumoconiosis actually is a broader term, right? So pneumoconiosis is a broader term in which we are having so many of number of diseases, right? And the main important ones we will be gonna talk about in this particular session, right? So occupational health diseases, right? So here the first one which I'm going to take, that is the pneumoconiosis. That is very, very important and very commonly tested in our MCQs as well. A pneumoconiosis, right? So again, guys, one question is very much expected from your MCQs point of view, and that is usually easy one only, right? So just let's listen to the section. It's going to be interesting, right? So these kind of diseases you will be studying in other subjects as well. For example, you might tackle them in the medicine, you might tackle them in the pathology, and so on, right? So let's talk about the pneumoconiosis, guys. Basically, if you talk about pneumoconiosis, they are gradually occupational related diseases, right? So generally they are occupation related. Okay, generally they are occupation related, right? Some person working in the coal mine, some person working in the lead battery, some person working in the automobile industry, some person working in cement industry, some person might be working in the cotton dust industry, paper industry. Okay, so there are a lot of occupations we are having, right? So in many fields, in every other kind of sector, we are having the workers, and according to their occupation they might be getting these diseases. These are the occupational related diseases, and we have just sum up in this particular category of pneumoconiosis, right? So basically these are the restrictive type of lung disease. Lung disease, if we talk about, basically what happens is usually all of these diseases are related to the lungs. Why is it so? Because usually they are working in that environment, and during the respiration process they are actually inhaling those harmful toxic substances, harmful toxic gases as well. With over time, if they will be keep on inhaling, keep on consuming these kind of gases, so gradually in the coming years, like 15, 20 years, 10, 15 years, right, depends on what kind of toxic gas they are inhaling. So due to that, the lungs injuries are happening, right? And usually the patients are landing up in the hospital saying that that's why occupation history is very important as far as our history taking is concerned, right? So that's why whenever we are taking the history also, we are actually always confirming the occupation as well, right? Because most of the times it can help us in making our diagnosis as well, right? So basically this is two kinds of lung diseases are there. We know that from the medicine part, that there could be the restrictive lung diseases and the obstructive lung disease. For example, COPD is a type of obstructive lung disease, right? Emphysema is a type of obstructive lung disease. Here these kind of occupation related diseases are the restrictive lung diseases, right? Okay, so these are generally restrictive lung diseases. Usually in the restrictive lung diseases, we are talking about the problem regarding the inhalation process, right? Inhalation. Obstructive lung diseases are having the problem with the exhalation generally, and restrictive lung diseases are having the problem generally with the inhalation part. So that is also the thing over here. So inhalation part will be compromised generally in these cases. If I'm talking about the dust particle which they're inhaling, or the gases which they're inhaling, if I'm talking about the size of these inhalation, okay, that has also been asked in one of the MCQ. that if I talk about the size of the dust particle which they are inhaling, right, what should be the minimal size, right? So over here we are saying that if it is 0.5 to 3 micron, right, if the dust particle is more than 0.5 to 3 micron, then it is considered to be the dangerous one, because it can actually go in your respiratory tract, in the upper and lower respiratory tract, and can cause, generally gradually it can cause damage over there, right? So basically we are saying that what should be the minimum size which is actually causing this particular problem. So inhalation of dust particles which are having size in between 0.5 to 3 micron, right, are generally considered to be dangerous, as they can cause lung injuries, to be dangerous. Okay, look at the classification part over here, guys. If you will be looking at this classification of the pneumoconiosis, right, let's try to understand that how many diseases are there. And usually direct question comes sometimes. If you are lucky enough, you will be getting the direct question from this particular table. Here, I have just inserted this table. Here on the one side, we are seeing that there are the type of dust, and on the other side, we are seeing that it is causing the disease. So here we are having two kinds of dust. One is the inorganic dust, and another one is the organic dust. Usually, organic dust is causing the hypersensitivity pneumoconiosis. Right? Usually it is causing the hypersensitivity pneumoconiosis. Which one? The organic dust. And so we are having inorganic dust, organic dust. Some diseases are there which are causing the inorganic dust. Some diseases are there which which are caused by the organic dust. So if you talk about the inorganic dust, or if you talk about the mineral dust over here, then very first one, very important one, that is the coal dust. Very commonly asked, but nowadays they are not asking you, because many of the people knows this coal dust, so it becomes very easy MCQ. So that's why they are not asking the coal dust nowadays. They started to ask about the silicosis, anthracosis, and all of these things, right? But however, that is very important. So coal dust is actually anthracosis, right? If it is the person who are working in the coal dust mines or coal mines, or all of these people might be developing the anthracosis. Obviously, it's not going to happen within 1 month of exposure, 2 months of exposure, or 4 months of exposure. Obviously, it's a gradual happening disease. So basically, they will be giving you a history of about 10 to 15 years, 5 to 10 years, 15, 20 years, depends on people to people, right? So that might be the case. Then silica, right? Then the silica is causing the silicosis. Very simple. Asbestos is causing the asbestosis. This is also having the capacity to cause the lung carcinoma, right? And it is very strongly associated with the mesothelioma, guys. That is also the MCQ. Will come to that. Then iron is actually the cirrhosis. Like that, we are having other also. We will be that is not that important, so that's why I am not included over here. Organic dust, if you talk about hypersensitivity pneumoconiosis, right? Hypersensitivity pneumoconiosis. Here we are talking about sugarcane fiber. Sugarcane fiber, if you talk about bagasosis, right? If you talk about sugarcane fiber, the people who are working in the sugarcane industries and all, they might be developing the bagasosis, because usually what happens is, I will be talking about the detail also as far as bagasosis is concerned. It is actually happening due to some fungus over there, right? We'll talk about that. Thermoactinomyces sacchari is the fungus over there, which is actually developing on the bagas. So bagas are actually, they are sugarcane, fibers over there, right? So due to that, it is actually happening. Okay, anyways, guys, then there is a cotton dust. Cotton dust is causing the bicinnosis. A simple mnemonic only, which I got from the students only, that, sugarcane, it is causing the bagasosis. So bag mein sugarcane dust, or bag mein sugarcane you can actually fill up. So bag mein sugarcane means bag mein karna, bag mein sugarcane means, so bagasosis is caused by the sugarcane. Like that, you can remember. And so just drawing it over here, that in the bag there are sugarcane. Right? So like that, you can remember the bagasosis. Bicinnosis, they told me about bicot. So you can remember like that. Okay, it's your way. So it's your choice. Bicot may be by, and you can take the cot from here. So bicot is bicinnosis happening by the cotton dust, right? Okay, anyways, tobacco is causing the tobaccosis, and hay or grain dust, the workers who are working over there, right, they might be developing the farmer's lung. Okay, so these are very important. Sometimes direct question you are getting, this table is worthy to discuss, because direct questions might be coming sometimes, right? And usually FMGs, they are asking you the direct question that bagasosis and bicinnosis, they might be confusing, so they might ask you from this part, that it might be, options might be differ, cotton dust, sugarcane dust, and all of these things might be in the options. So they might ask you bagasosis and bicinnosis, like that. Okay, so very important table. Now it's worth mentioning that the difference between the two important diseases over here. The two important diseases which I'm gonna differentiate over here, because difference is very important and very usually, very commonly they're asking us in the PG examination also and in the FMGE examination also. That is the difference between the silicosis and the asbestosis. So let's talk about silicosis and the asbestosis difference now. So if we talk about, guys, the asbestosis, then it is actually asbestos fiber, that is very very common sense question, and silicosis is caused by the inhalation of the silica dust. But now the story changes, right? Now the other things they might be asking you. For an example, mechanism. Basically, it is causing the mechanical irritation in the lungs, right? Asbestosis, if you talk about, and silicosis, it might cause the blockage of the lymph, right? So lymph flow might be disturbed over there. If you talk about the asbestosis, then it can cause the diffuse fibrosis, and if you talk about the silicosis, it can cause the nodular fibrosis. Due to these nodules, guys, it can actually show the snowstorm appearance on the X-ray. It can actually show the snowstorm appearance on the X-ray, right? Now you may ask me that, if the asbestosis is showing the diffuse fibrosis, then it can cause which kind of X-ray? So it might be causing the ground glass appearance on X-ray. It might be causing the ground glass appearance on X-ray, right? So asbestosis might be showing the ground glass appearance on X-ray, and silicosis might be showing the snowstorm appearance on X-ray. Very important for you guys. If you talk about the lungs further, then asbestosis might be causing the basal location in the lungs. There is a basal location. If you talk about the asbestosis, basically over here, it can cause the peribronchial fibrosis, guys. It can cause peribronchial fibrosis. So I'm just writing over here that it can cause the peribronchial fibrosis. Right? And if you talk about, this is a diffuse peribronchial, by the way, diffuse peribronchial fibrosis, right? Further, it can cause the bronchiolitis as well. Right? So I'm just writing the differences over here itself. For an example, this is the differentiating line, right? So two more differences you should know: peribronchial fibrosis, diffuse peribronchial fibrosis, and the bronchiolitis, right? One more point over here in the asbestosis, guys. In the asbestosis only, that it is having a very strong association with the mesothelioma. So I told you, associated with what? Mesothelioma. So that is also your MCQ. It is associated with what? It is associated with mesothelioma. It is having the capacity to cause one cancer. Very important, guys. Very commonly asked, lung cancer or the bronchial carcinoma, to be very specific. So it is causing the bronchial carcinoma or the lung carcinoma. Does it have the capacity to cause the cancer? Obviously, just now I told you it is having the lung cancer. So can I say, is it pre-malignant? Yes, it is more pre-malignant as compared to silicosis. It is more pre-malignant. Okay. So very dangerous kind of disease it is. This is the asbestosis. Here the fibers are actually accumulating over there, can cause the bronchiolitis, and basically it is actually affecting the lower part of the lungs. So affecting lower parts of lungs. So it affects basically the lower part of lungs. Okay. So that is very important. So these are some of the differences which I shall which we shall actually remember about the asbestosis. Now silicosis, if we talk about, guys, some more differences I'm gonna mention over here. For example, it is happening in the upper part of the lungs, and this was happening in the lower part of the lungs. I told you asbestosis was happening in the lower part, and silica is actually depositing in the upper part of the lung. Due to that, it might cause the alveolitis, guys. Right? It is comparatively not pre-malignant. It is comparatively non-pre-malignant, so it is not causing the cancer as such. If they're asking you about the cancer formation, basically probably they want to ask you about the asbestosis, right? Then they might be causing the nodular fibrosis. I told you earlier, right? Snowstorm appearance on the X-ray, it will be showing basically. But one more important thing which I want to mention over here, I'm just changing the color for that. It is having high chances, these patients of having high chances of developing the TB. That is very important point over here. High chances of developing the tuberculosis. So that you should remember. So basically, in a nutshell, you should remember, very commonly asked, which of the following disease is causing the TB formation. So that will, in that case, your answer will be the silicosis. Which of the following can be pre-malignant? Then in that case, your answer will be the asbestosis. Which of the following is having the association with the mesothelioma or might cause the mesothelioma? Then your answer would be the asbestosis. Which of the following can be causing, the cancer over there, or the bronchial carcinoma, lung carcinoma? That is again the asbestosis, right? So these are some of the very important differences which you shall not forget for your exams, right? Okay. So straight away question might come, guys. Okay. So just listen to the section carefully and you are done with that. Okay. Now next point which I wanna take over here, the next disease which I wanna take over here. So we have talked about the silicosis, we have talked about the asbestosis. Let's talk some point about the bagasosis also. Yeah, bagasosis, right? Bagas. Bagasse, where you are finding the bagasse? On the sugarcane, right? On the sugarcane. So sugarcane dust fibers, okay, the workers who are working over there, the employees who are working over there, they might be getting this bagasse, right? So there is a fungus which is actually proliferating on the surface of the bagasse, on the surface of the sugarcane, right? That's why they are causing this particular disease. So guys, let's have some discussion about the bagasse. So basically, bagasse, if we talk about it, is caused by the inhalation of what? It is basically caused by inhaling bagasse dust, okay, caused by inhaling the bagasse dust. What is bagasse dust? It is nothing but the remnant of sugarcane only. Remnant of sugarcane. Okay, that's how they came up with this name. Okay, that's why it is called as the bagasse, right? Next one, it is actually contaminated, guys. It is actually contaminated by one fungus, which I told you right now. It is actually contaminated by one fungus. And can you tell me the name of the fungus? However, I have mentioned it in the earlier section only, that the name of the fungus was, guys, Thermoactinomyces, right? Thermoactinomyces Saccharei. Remember that with Shakkar is related to the sugarcane only, right? So Shakkar means sugar. In Hindi, you call it as Shakkar, right? So Saccharei, okay, that in that manner you can remember. Thermoactinomyces Saccharei, okay. Because at the end, guys, you're gonna answer the questions in a form of MCQs. If you will just remember the Shakkar only, right? So smart study is also important. So contaminated by the fungus, right? Next point over here, which you need to control, that which you need to discuss over here, that how to control this fungus, how you can treat this fungus. Is it possible then that workers might be getting prevention from these things? Yes, it is. So basically what we are doing, we are doing the fungal control on bagasse, right, by using the propionic acid, guys. Okay, by using the actually 2% propionic acid we are using, right? 2% propionic acid, right? And we are keeping the moisture. We are keeping the moisture over 20%, right? And keeping the moisture over 20%. That's how we can actually prevent this basically fungus also, right? So if the fungus, in a nutshell, if a fungus will not be there, then probably these people who are working over there, the workers who are working over there, might be getting this fungus, but very late. Okay, not sooner over here. So that is basically about the bagasse also. It can be prevented by the 2% propionic acid or by increasing the moisture over 20%, right? Once we are done with that, guys, now we shall move on to one more disease over here, that is farmer lung. So now what is farmer lung? Farmer lung, basically I told you that the people who are working in the area of moldy hay and the grains area, right? So over there they might be developing this farmer's lung basically. So I said that it is actually occurring due to the inhalation of, again guys, inhalational injury. Occupational lung disease are usually the lung diseases, occupation diseases. So inhalation of the hay, right? This is the moldy hay, or it might be grains, right, which are causing this particular farmer's lung, right? One more thing over here, guys, it is actually caused by one particular fungus over here, that is the thermophilic actinomyces like fungus, okay. And the name of this fungus is, I'm just changing the color for that is the Saccharopolyspora ractivirgula, but earlier it was usually called as the Micropolyspora feni. Okay, you might have heard about that name, but now they are calling this as with other names, so I am just mentioning about that name over here. So it is the Saccharopolyspora ractivirgula. Okay, and earlier guys, formerly, right, earlier it used to be called by the name of very famous one, Micropolyspora feni. Okay, so in earlier times, okay, it has been asked which fungus is causing this. So fungus is very important, guys, because it might be you might forget this kind of fungus. That's why they might ask you. Otherwise, other part is very simple to remember over here. You just don't even need the revision for that, because if you will be seeing the option, you will be able to figure out that yes, this is talking about that thing. But fungus might be slipped out from the mind, so that's why they might ask you the fungus. So Micropolyspora feni, okay, they have already asked multiple times this fungus, but now it is actually called as the Saccharopolyspora ractivirgula. So basically this fungus might be asked. right? So new name might be asked over here, so that's why be very careful with that. I'm just marking that this might be your MCQ, right? So please go through that. Now I'm coming to the occupational cancers, guys. I'm coming to the occupational cancers, and here we can see over here. Okay, I will just zoom in this picture. So occupational cancer, if you guys talk about, then we are having different kinds of agents which can cause different kinds of cancer over there, right? For example, if we talk about most common occupation cancer, which is the cancer of the skin, that is the squamous cell carcinoma, right? Basal cell carcinoma, squamous cell carcinoma, we have talked about that in dermatology. So basically squamous cell carcinoma and the basal cell carcinoma, right? Which kind of carcinoma is very common? The first of all, which organ cancer is very common? That is the skin cancer due to the occupational diseases, and squamous cell carcinoma is very common. That is the most common occupational cancer. That is the squamous cell carcinoma of the skin. So guys, over here we are having several kind of agents which are causing several kind of diseases over here, right? So let's talk about them one by one. For example, let's take on very first one over here, that is the arsenic. Arsenic is having the capability to affect the lungs, skin, and the it might be causing the sarcoma also, that is the hemangiosarcoma. Over here it might be present in alloys, it might be present in the electrical devices and the medications, fungicides also, and that is the thing over here, right? So asbestosis, if you guys talk about asbestos, we have just talked about the asbestos, that it is a pre-malignant, might be causing the mesothelioma, very strongly associated with the mesothelioma, and it is having the capacity to cause the lung carcinoma, peribronchial fibrosis, all of these things. So over here it is having the capacity to cause the mesothelioma, as we have talked about earlier, obviously affecting the lungs over here. So it might be present where the construction workers and the textile workers are actually exposed usually. Talking about the benzene, guys, it is having the capacity to cause the urinary bladder carcinoma. Okay, we'll talk about that in coming time. But over here, leukemia, Hodgkin lymphoma, it might be causing basically, and it might present in the light oil or the solvent and the fumigant, right? Then if you talk about the beryllium, it might be affecting the lungs. Cadmium, it might be affecting the prostate, and chromium, it might be affecting the lungs, right? Then if you talk about ethylene oxide, it is causing the leukemia, nickel causing the nose or the lungs. Basically these organs might be affected over here. Radon, lung, and vinyl chloride might be causing the angiosarcoma of the liver. The most important one which you need to remember, guys, which you shall remember, if you are remembering all of them, then very nice, but want to remember specifically, then asbestos is very important, benzene very important, beryllium is also important, guys. After that you might remember the vinyl chloride. Okay, so and the arsenic one. So these are 5 or 6 very important one which you need to remember as far as the occupational cancer is concerned, occupational cancers are concerned, right? So over here we shall mention about some important point over here which you need to remember. For an example, what is the most common occupational carcinoma or occupational disease over here? So most common occupational carcinoma, if I will talk about, as I have named it earlier as well, this will be the squamous cell carcinoma of skin. Next question which they might ask you over here, that it is having the association with what? It might be having association with so many of things. It might be having association with the radiation part, it might be having the association with the dyes, it might be having association with the coal tar and all of these things, right? So it might be associated with all of these things. If you talk about the lung carcinoma, they are very common in the heavy metal industries over there, right? So the workers who are actually working in the heavy metal industries, right, they might be having the exposure of these kind of things. So basically due to those harmful exposure, they might be developing the lung carcinoma if they are obviously working for a very long period of time, or they are exposed to those heavy metal industries, toxins for a very long period of time, obviously. So one more point over here, that lung carcinoma, the lung CA, basically it is very common in which industries? Are common in heavy metal industries, common in heavy metal industries, right? Okay, heavy metal industries. Next point over here, basically if you talk about the bladder carcinoma, I told you that usually due to the exposure of benzene, benzidine, oramine, all of these things are there. So basically once they asked you that which of the following is not causing the bladder cancer, or which of the following is not the exposure which is causing the bladder carcinoma. So that's why I'm just mentioning this particular point over here. So bladder CA, right, bladder carcinoma is actually related to, or is actually associated with the exposure of, is associated with, this is a sign of associated with exposure to, right, exposure to how many things, right? For an example, benzene, very important, and I know you will be remembering this, benzidine, right, with that oramine, Okay, magenta, your drug basically, that is a cyclophosphamide, right? Very commonly, this is the pharma question as well, that which of the following drugs might be causing the blood letter CA, that is the cyclophosphamide, very commonly asked, guys. So next one we are having the beta naphthylamines, right? Okay, naphthylamines. So these are the basically exposures which might be causing the bladder carcinoma, right? Now we shall move on to the one more important syndrome which might be asked, which is actually related to the occupational diseases. That's why I'm mentioning it over here. However, in the detail you might have talked about that in the medicine section. That is the Kaplan syndrome. So basically, if we talk about the Kaplan syndrome, some of you might remember it with the name of one coaching also, that is the coaching for the USMLE, right? So Kaplan syndrome, basically if you talk about, this is the occupational lung diseases. Some person might be having the occupational lung diseases or occupational disease, any kind of occupational diseases. I mean any kind of occupational disease. I mean I shall mention about the pneumoconiosis, right? I shall write pneumoconiosis. With the pneumoconiosis, it might be bagasosis, byssinosis, anthracosis, any of these. Then with that they might be developing the rheumatoid arthritis, guys. RA, rheumatoid arthritis, yes, rheumatological disorder. So rheumatoid arthritis. With that, they might be having or might not be developing the nodules. They might be intrapulmonary nodules. So they might be developing or might not be developing the fibrosis or intrapulmonary nodules, right? Intrapulmonary nodules. Okay, so that is the thing over here. After that, we shall talk about the white finger syndrome, or it is also called as the vibration syndrome or the vibration disease. So let's talk about the white finger syndrome. As the name suggests, guys, very easy to understand that here the person will be having the white fingers in color, right? Here the person will be having the white fingers, right? In the white finger syndrome, basically we are talking about that this is a vibration injury. It is also called as, right? This is the vibration injury, or it can be called as a vibration disease or vibration syndrome. So it is a vibration disease basically, or vibration injury, right? Here what happens, the workers who are actually working with the very heavy kind of machines, right? They are actually using for granite purpose or very heavy construction sites. Okay, these kind of workers might be developing the vibration disease or vibration injury. It's very easy to understand. For example, here in this image you can see that this is the a machine over here which this person is actually taking, and he's actually drilling over the road over there. Obviously it will be causing so much of vibration, right? Because it will be causing so much of vibration, they might be and if they are doing it for a very long period of time, they're doing it for days, they're doing it for weeks, months, right? So obviously due to that, what will happen, due to that, vasospasm or the vasoconstriction happens in the hands and the fingers, right? And due to that problem, they might be developing the white color fingers basically, right? So that is the cause for causing this vibration injury, right? So once they will be developing this particular color, right, which I'm showing you over here. So here what we can see over here, right? Look at the fingers over here, look at the color over here. Here the person is having the red color, but here they are having the white color fingers, right? Why is it so? Obviously because what is happening due to the vibration disease, right? It is also related to the Raynaud's phenomena, because in the Raynaud's phenomena also we are talking about what? Discoloration of the fingers, right? Discoloration of the finger, right? You must have talked about there are three colors which we are talking about in the Raynaud's phenomena. Obviously it's not coming in the PSM section, it is coming in the other section, for example in the medicine. So we are talking about the white color finger, blue color finger, and the red color finger. So at last they are having the red color over there. So yes, that pattern is also asked in the exams, but that is the medicine section over here. But it is also related to the Raynaud's phenomena. Same kind of picture might be seen for the Raynaud's phenomena as well. So this is the vibration disease, guys. So here what we need to understand, that this is the vibration disease, and here it is causing the vasospasm or vasoconstriction in the fingers, or in the hand. Due to that, what will happen? Due to that, the sensation will be absent in this particular area. Sensation will be absent, and there would be the pallor discoloration, pale color, obviously as you can see in the image also, right? Then with that, it might be related with the, as I told you, it might be related with what phenomena or what disease? Yes, that is the Raynaud's phenomena, right? Very popular one, Raynaud's phenomena. I know everybody knows this. So Raynaud's disease. Okay, so it might be related with that, right? So in what places you can see this? In what places if I'm talking about, then it will be seen in heavy construction workers, right? Heavy construction workers who are working with the drill machine and all of these things, right? They might be developing this. Heavy construction workers or heavy machine workers, right? Heavy machine So they might be causing these things. Okay. So once we have talked about that, this is very easy to understand. Vibration disease, vibration injury, white finger syndrome, right? Now we shall come over to the very important occupational disease over here. That is the plumbism. I know, everybody knows this. I know you guys are just shouting that what is a plumbism over here. Plumbism is the lead toxicity, right? You might have heard about this in the pathology section. You might have heard about this in the medicine section, right? So many places. And here in the PSM also, I'm going to talk about the plumbism, that is lead toxicity. It is a very easy, right? Just relax back and just listen to this. So over here, we are going to talk about the lead toxicity, guys. Lead toxicity. First of all, how many names we are having in the lead toxicity, so that we are not confused when they are asking you. For example, they asked you what is which of the following symptoms will be seen in the Saturnism, and you'll be thinking like, what is Saturnism, man? But you have talked about, you have learned the lead toxicity. It is nothing but the lead toxicity only. So let's talk about these names also. So it is also called as the plumbism, guys. It is also called as the plumbism. It is also called as the Saturnism. So please do not confuse if they're asking you these. Examiner might be asking these kind of terms, so that they want to check your knowledge, that whether you know these kind of things, like the synonyms of these particular terms, right? It might be also called as a painter's colic, guys, because it is found in the painters and all, who are working with the lead batteries, automobile industry, and painter and paper industry, right? These are the occupation where we are finding very commonly these kind of particular disease, right? So this is the lead toxicity, guys. Welcome to the lead toxicity. This is the plumbism, Saturnism, or the painter's colic, right? So once we are clear with that, let's move on into the diving into the lead toxicity. So here we are talking about what is the source of exposure. First question, what is the source of exposure over here? If you talk about the source of exposure, then it will be the, obviously I told you that it might be the lead batteries, might be the automobile industries, right? Might be the automobile industries. It might be the painters who are working over there, automobile industries, right? It might be the painters, painting and all. This can be the source over there. So these are the various occupational exposures might be there. So some of them I have just mentioned about in the source of exposure. What is the route of absorption? Basically, in the children it is different, and in the adults it is different, but usually very commonly they are asking you about the adults. If nothing is mentioned, then you will be considering that as adult only. If they have mentioned that what is the most common route of absorption as far as lead toxicity is concerned in children, they have mentioned, or they mentioned about the age also, less than 15 years, let's say. So in those cases only you will be talking about the children. Otherwise, most commonly they're asking about the adults. So guys, if you talk about, if they're asking you what is the route of absorption of the lead for causing this particular plumbism or the Saturnism or the lead toxicity. So route of absorption, if you talk about, it is different in the children and it is different in the adult age group. In the children, if we talk about, in the children, it might be causing your due to the ingestion, but usually in the adults, or usually very commonly, it is actually caused by the inhalational route. So basically, inhalational route or the respiratory tract, right? Inhalational route or the respiratory tract way over here, right? What could be the mechanism of action? What could be the mechanism of action? I'm just writing the MOA over here. Okay, just get it. So what is the MOA, a mechanism of action for this one? So what happens is, whenever the lead through the, let's say through the inhalational form, it is coming into the lungs, and from the lungs it might go into the blood, and then what will change in your body? What will be the change in your body? So basically this lead particularly, it will be binding to the sulfhydryl group. It will be binding to the sulfhydryl group. As it will be binding to the sulfhydryl group, it will be inhibiting something. What will be inhibiting? So let me mention over here. So it will be binding to the sulfhydryl group, right? After that, it will be inhibiting the two important thing over here. One is the ALA, aminolevulinic acid dehydrogenase. This is the enzyme, guys. ALA dehydrogenase, and other one which it will be inhibiting, that is the ferrochelatase. Okay, other one which it will be inhibiting, that is the ferrochelatase. With that, it is also having the capacity to inhibit the pyrimidine 5' nucleotidase. Okay, all of these are your MCQs, guys. So pyrimidine 5' nucleotidase. Okay, it is causing that. With that, after all, at last, it will be competing with the calcium. It will be competing with the calcium. That's why in the treatment part, I will be telling you that chelation is very important in this case, right? So calcium chelating agent will be giving them over here. Okay, anyways, so what will happen next? Then it will be chelating the calcium and it will be competing with calcium. So that's why the chelating is important in the treatment part. I will be talking about that. So it will be competing with the calcium. So that's why these patients might be having the hypocalcemia. Are you understanding? So it's very easy to understand. So these four phenomena you need to understand over here as far as lead is concerned, right? So how the lead is coming into the body. If you talk about the children, it is through the inhalational form, or right, or if you talk about the adults, right, because they are working in the painting, with the paint, which kind of smell is there, right? Pungent kind of smell is coming from the paint, right? Yeah, some of you will be saying that it's a very good smell, but anyways guys, if you will be, but you are just going in a newly furnished home, right, and the painting fragrance or smell, whatever you want to call it, it is coming from that, and you will be feeling that very comfortable, that yes, a good smell is coming. But the painter, if you talk about the painter, after painting your home, you will be going to some other home for the painting purpose, right? So for years and years these kind of workers are doing that. So if they will be having the chronic exposure of these things, they might be having the lead toxicity. So through what way it is going into their body? Through the inhalational form only, right? And at one point of time, they will not be feeling any kind of smell from these paint and all, right? So because obviously because of the chronic exposure, right? For example, you are going to buy some kind of perfume, or right? So over there also there will be actually some kind of coffee packet, or they are having the coffee box over there, so that once you are inhaling the fragrance of one particular perfume, you might not be able to differentiate the fragrance of the two perfumes, because your nose receptors will be actually they will be desensitized. So due to that, they are actually oversensitized. So due to that, they are having that coffee over here, so that you will be taking the you will be inhaling the coffee, and then you can actually able to differentiate. You may be able to differentiate the fragrance of the perfumes, and you can decide it around, right? So that is the thing over here. So what is the most common route of absorption? That was the inhalational form, right? Okay. So once we have talked about that, what about diagnostic modalities? How we can diagnose the lead toxicity? But before that, let me come to the point that it might be causing the acute toxicity. Once the lead will be coming, we have talked about the mechanism of action. Once the lead will be coming inside our body, it might be causing the drastic changes inside the body. For an example, it might be causing the acute toxicity to our body. For an example, GI tract might be getting affected, bone marrow might be getting affected over here. And if I'm talking about the chronic toxicity, it can affect the not the cardiovascular system. It might be affecting the CNS, right? Central nervous system, and it might be actually affecting the kidneys also, right? So it might be causing two kinds of toxicities over here. It might be causing the acute toxicity, and it might be causing the chronic toxicity, right? So acute toxicity and the chronic toxicity. In the acute toxicity, if I've been talking about, then basically it can involve the GI tract and the bone marrow. For example, if they will be asking you which organs are affected in the acute toxicity, then these are the organs. If you talk about the chronic toxicity, then it might be affecting the CNS, or it might be affecting your kidneys, right? It might be affecting your kidneys. Okay, right. Then after that, let me talk about the diagnostic modality. How you can make the diagnosis for the lead toxicity over here, right? So we are having the screening test and we are having the confirmatory test. As far as screening test is concerned, right? As far as screening test is concerned, we'll be asking for the urine sample of this patient. Asking for the urine sample for this patient for the screening part. I said, first of all, whenever you are suspecting the lead toxicity, I'll be talking about the features also. First of all, let me just finish over this particular thing. So if we talk about the screening test over here, we will be actually checking for the urine sample. In the urine sample, what particular thing you will be asking for? You will be checking for, that is porphyrin 3. You will be checking for porphyrin 3 levels in the urine. Porphyrin 3 levels in the urine you will be checking for over there. Other than that, you might be checking the amino levulinic acid in the urine. What is the ALA? Amino levulinic acid. Okay. So no confusion. Third thing which you can check for, that is the confirmatory test, right? So two things we have talked about: porphyrin 3 levels and your ALA, that is the ALA, amino levulinic acid in the urine. These are the two screening tests. Okay, very important. They have been asked earlier as well. And if you talk about the C, that is the confirmatory test. Confirmatory test over here, then obviously you will be taking the blood sample. In the blood, directly check for the lead levels over here. So blood lead levels will be the confirmatory test. Very simple. Blood lead levels will be the confirmatory test over here. If you talk about the occupational exposure to this lead, if it is more than 40 milligram per deciliter, right, then we are saying it is the occupational exposure. However, if you talk about the onset of symptoms which will be start coming in the patient, right, which kind of symptom we talk about shortly. If the onset of symptoms we talk about, then if it is more than 70 milligram per deciliter, then we are saying that more than 70 microgram per deciliter, then we will be saying that the person might be developing the lead toxicity. It will be start showing the signs and symptoms of the lead toxicity. So what I said over here, guys, I said that if the person is actually showing you the symptoms, right, the onset of symptoms will be start appearing when the person will be having the levels of lead that will be 70 microgram per deciliter, right? At what point of time I will be saying that the person is having the occupational exposure? 2 points I told you. Occupational exposure, right? Because the examiner might trap you over here. So occupational exposure, if they will be asking you, then it will be 40 microgram per deciliter, right? So be very clear with that. Onset of symptoms at what level and the occupational exposure at what, right? So once we have talked about that, we shall talk about the treatment modality now, right? If we talk about the treatment modality, then we can say it will be the chelation, right? Because I told you that it was actually competing with the calcium ions. So due to that, we can do the lead chelation over here. So in the treatment part, we can write that it might be causing the lead chelation. Right? Second point over here, that you might be using the calcium EDTA, okay, or D-penicillamine, right? Or you might be using the dimer-caprol. These are the options we are having in front of us as far as lead toxicity is concerned, and we can use these kind of drugs, right? The more details you will be reading them in the medicine section, in the lead toxicity, right, or in the plumbism, right? So some of the things which we are seeing over here, that here we are seeing the Burtonian lines on the gums, right? Here this is the line, okay, which you are seeing over here. These are the Burtonian lines can be seen on the gums over here, right? So these are what? Burtonian lines on the gums. Burtonian lines on gums, right? Then you might be seeing the anemia in these kind of patient, right? You might be seeing the basophilic stripling in these kind of patient. You might be seeing the colic pains in these kind of patient, right? So here what I'm saying, here I'm seeing the basophilic stripling. Basophilic stripling over here. Where I'm seeing the basophilic stripling? Look at this basophil. Okay, these are the RBCs. These are your RBCs. You might have talked about that in the pathology, right? How to identify the sites. So here we are seeing these are the RBCs. And this over here, this particular thing is the basophil over here. In the basophil, we are seeing that purple dots are present over there. These purple dots, basically, they are representing the stripling of these basophils, right? So this is the stripling of the basophil. Basophil stripling can be seen. Along with that, the patient might be having the colic pain, abdominal colic pain can be there, constipation can be there, the foot drop or wrist drop. Okay, these kind of symptoms might be there in these kind of patient. The patient might be having the pallor, the facial pallor might be appearing in these kind of patients. So these are some of the symptoms which we shall remember as far as this lead poisoning is, right? So there is a mnemonic for the lead poisoning as well. Okay, let me talk about that as well. So what are the clinical features of the lead poisoning, guys? So clinical features, as you can see over here for the lead poisoning, right? So as I told you, you can remember them with the alphabets only, A, B, C, D, E, right? So A for anemia over here, A for anemia, right? B for basophilic stripling, we have seen the diagram as well. C for colic or the constipation, as we have talked about that earlier. D for dropsy, here we can talk about the wrist drop or foot drop, right? This term you might have heard about them in the orthopedics. Then E for encephalopathy, it might cause encephalopathy in the severe cases. F for facial pallor, as we have talked about, and this is the earliest sign. Facial pallor is the earliest sign over here. G for gum line, we saw that there is a Burtonian line can be seen on the gums region. We have seen that in the image also. And H for hormonal problems might be seen, right? So these are some of the lead poisoning features, right? So in a nutshell, guys, what is the lead poisoning? It is basically, it can also be called as, also known as the plumbism or the saturnism or the lead toxicity, right? And basically it is caused by the inhalational form as far as adults are concerned. In the children, it might be seen due to the ingestion form. It is having so many important features which can be seen over there. What are the important features which might be asked in your exams? That is your what are the Burtonian lines, and what about the basophilic stripling and the wrist drop and the foot drop? These are the most common features which can be seen in the lead toxicity. How we can make the diagnosis as far as screening test and confirmatory test. Two tests are important over here. As far as screening test is concerned, we are taking the urine sample for the patient. We might be checking the ALA levels, that is the aminolevulinic acid levels, and the corporphyrin 3 levels in the urine. And then we might be checking the blood sample for the confirmatory test. We'll be seeing the blood lead levels over there, right? What about the treatment over here? I told you that there could be the uses of chelation, there could be the uses of calcium EDTA, there could be the use of dimercaprol, and these are the treatment modalities, right? Now we shall come over to the another very important topic, that is the decompression sickness.